Assalamu alaikum. Today our topic is uterovaginal prolapse or pelvic organ prolapse. You can name it both ways and define it is defined as pelvic organ prolapse is the herniation of pelvic organ to and beyond the vaginal wall. You remember here that it is caused by failure of interaction between the levator ani muscle. Levator ani muscle is the muscle that makes floor of the pelvis and the ligaments and fascia that support the pelvic organs. Uterovaginal prolapse is also defined as protrusion of uterus and vagina beyond their normal anatomical confines. This is your exam question. Define uterovaginal prolapse. Okay, uterovaginal prolapse is subclassified into uterine prolapse and vaginal prolapse. In the coming few minutes, I am going to tell you how to classify uterovaginal prolapse. And in your exam, you don't have to write this classification. It is just a normal classification. The next classification which I am going to teach you is what you have to write and explain in your examination. What are the supports of pelvic viscera? You should know about the normal structures. This is just a quick revision. The pelvis support of the pelvic viscera are by the pelvic floor musculature and the ligaments. The pelvic ligaments are condensations of fascia which hold the uterus and the upper part of the vagina in its normal anatomical position, and the weakness of these ligaments results in various types of uterovaginal prolapse. Okay, so what are the ligaments? Cardinal ligaments, uterosacral ligaments, round ligaments, pubocervical ligaments, posterior pubo-urethral ligaments. And the pelvic floor muscles are mainly mainly comprise of levator ani and coccygeus. These muscles are added by urogenital diaphragm. Okay, and the urogenital diaphragm is the superficial and the deep perineal muscles. So the levator ani consists of two parts called pubococcygeal and iliococcygeal muscles, and superficial and deep perineal muscles are there. If you are asked anywhere that name three structures that support pelvic organs, so you have to write levator ani muscle because this is the main supporting muscle. Connective tissue and ligaments. In the ligaments you can name the ligaments. I have written here, and vaginal wall. These are the supporting structure of the pelvic organs, and this is I have drawn a diagram here. You should remember these positions, okay, because it is very important to remember these positions. In the coming the lectures, I have to explain different diseases for which you should know that in the anterior compartment there is the bladder, and in the posterior compartment the bowel is present, and this is the anterior vaginal wall. This is the uterus. This is the anterior vaginal wall, and this is the posterior vaginal wall. I repeat, anterior vaginal wall and posterior vaginal wall. Anterior to the anterior vaginal wall is the the urinary bladder, its upper two-third, and the urethra. Okay, anterior vaginal wall, upper bladder, it's and the urethra. And posterior to the posterior vaginal wall is the rectum in its lower two-third, and upper one-third is related to pouch of Douglas. This is very important to understand. Now, moving on, what is vaginal prolapse? Well, this is why I was explaining the diagram. So, the first disease is vaginal prolapse. The first complication or disease is vaginal prolapse. It is subdivided into anterior vaginal wall. Vaginal compartment is divided into anterior vaginal wall, the posterior vaginal wall, and the vaginal vault prolapse. So anterior vaginal wall is related to the urinary bladder, its upper two-third. Anterior vaginal wall is related to the urinary bladder, its upper two-third, and the urethra's lower one-third. And the posterior vaginal wall is related to the rectum's two-third, the upper one-third of pouch of Douglas and its contact, and then is the vaginal wall. Then there is a question, and this is a topic as well, that classify vaginal prolapse. No, pelvic organ prolapse, sorry. Classify pelvic organ prolapse. So you have to classify it by first dividing it into apical compartment prolapse, in which we have vaginal prolapse and vault prolapse and uterine prolapse. Vault prolapse I have defined here. It is vault is the blind upper end of after hysterectomy, and its prolapse is called vault prolapse. Okay, so after hysterectomy, this is the upper end of vault which has prolapsed, and this is simply called vault prolapse. And uterine prolapse is discussed on the next page. Then there is anterior compartment prolapse and posterior compartment prolapse. The anterior compartment prolapse is defined after their content. Okay, the division is according to the content. The first is cystocele. What is cystocele? When the descent of two-thirds of anterior vaginal wall. Look, I have made a diagram. Look at this diagram. This is the anterior vaginal wall. Anterior vaginal wall. When the descent of the upper two-thirds of the anterior vaginal wall occurs, this is known as cystocele. And what are the contents of cystocele? Urinary bladder. Okay, so when a patient or in a scenario you are given asked about cystocele, so their presenting complaints will be related to the urinary bladder, such as urine infrequency, urine incontinence frequency, and UTI, etc. So cystocele is the descent of the upper two-thirds of the anterior vaginal wall, and the contents are urinary bladder. Then the second is urethrocoele. If in a division where when anything is classified, you should always focus on the system of the classification. Okay, so in this anterior compartment or posterior, first the upper two-thirds of the anterior vaginal wall is divided, then the lower one-third, and then whole of the anterior vaginal wall. And in the posterior compartment, first the upper two-thirds, then the lower one-third. Okay, so when we say urethrocoele, remember that urethra, so the prolapse is of urethra. And again, the patient's complaints are related to urine and urine frequencies, etc. The descent of lower one-third of anterior vaginal wall is known as urethrocoele, and it contains what? The urethra. Okay, because the lower one-third of urethra was present, so when the lower one-third of urethra descends, the lower one-third it means, as a result, the lower one-third of anterior vaginal wall will descend, and this condition is known as urethrocoele. When the upper two-third descends, then urinary bladder. And what is cystourethrocoele? Cystourethrocoele is the descent of whole anterior vaginal wall. So when the whole anterior vaginal wall has descended, then it is common sense that the urinary bladder and urethra both have descended. Okay, I hope these diagrams are clear to you. I have tried my best to make them as clear as possible. Then moving on to the posterior compartment prolapse. In the posterior compartment prolapse, the posterior vaginal wall prolapse is present. Again, we will go systematically. First, we talk about the rectocoele. Remember, rectocoele, rectum has descended into the lower two-third of posterior vaginal wall. Rectum lies lower, so the lower two-third of posterior vaginal wall has descended. And what does it contain? It contains the rectum. So then we have enterocoel. In the enterocoel, the upper one third which is left, we have discussed the lower two third. The lower two third contained rectum. So when the upper one third of the posterior vaginal wall is discussed, so it will contain the small bowel and the omentum. Okay, I hope this is clear to you. When you are asked in your exam that classify pelvic organ prolapse, you have to first divide it into apical compartment prolapse, anterior compartment prolapse, and posterior compartment prolapse. In anterior compartment prolapse, you have to talk about cystocele, urethrocoele, and cystourethrocoele.